not a public speaker, so.
Trust me, the last person on earth, yeah.
Yeah. My tooth fell out since I last saw you too.
Mhm.
Okay.
All right. Hello, everyone. This is Dr. Khan, and it's a pleasure for me to have a wonderful patient of mine from Tennessee. So, very interesting case, and I just want to go ahead and hear directly from her because I was very impressed as to why and how she ended up finding me and convinced truly that she needed to get this surgery done. And in hindsight, now looking at it from the Facebook Live from last Thursday, absolutely very much indicated surgery. So you had your first set of implants, saline implants in 1998, and then you basically had those for a period of time till you ended up getting the second set, which were the silicone implants in 2019. Then your symptoms got worse, and you said you want to go ahead and get an explant. And just March of this year, basically 2 months ago, you ended up getting an explant. During that surgery, in March of 2025, just 2 months ago, your surgeon made the incision on the right side. And lo and behold, to his total surprise, and to your surprise as well, the right breast implant was indeed very much ruptured. And then the surgeon ended up removing the implant, and he felt that the capsule was so thin, he left it behind. And then the left breast implant was removed, and the left breast implant was very much intact. Now, let me go ahead and ask you a few questions. At what time did you know, or when did you know that the implants were causing the problem and that you needed an explant?
Well, from the very beginning, when I had them put in, I broke out with this horrible rash all over my chest, up my throat. I had knots all over my neck. And when I contacted the surgeon again, I thought, oh my goodness, they must have latex in them. And then he assured me they did not. Within a couple of weeks, all of that went away. And then I just started having
This
symptoms.
was what year?
This was 6 years ago when I had them in. What year was that?
2019.
2019.
Got it, okay.
Yes. And so then I just started having extreme fatigue, unbelievable fatigue. And I thought it was because maybe I was approaching menopause. I started having anxiety. I thought it was because I had lost a friend and just certain traumas were adding up. I went to different doctors because I had back pain. I had an E-sure put in, and they thought maybe that was causing it, so I had a hysterectomy, thinking that would relieve the symptoms. I had autoimmune type symptoms. I had allergy tests. I had dizziness, and so then I was referred to ear, nose, and throat specialist, which talked me into getting. I had a deviated septum. They said that would help with the dizziness. So then I went back. And they said, oh, that had nothing to do with it. So then I went on to, I had side issues. I went through a multitude of testing on that. The doctors couldn't find anything. They did intense testing on my gallbladder. They said it was functioning at 97%, but they still wanted to take it out because, that could be the cause. And I said, no, you're not taking out an organ. Last May of 2024, I had severe back pain to the point where I couldn't get off the sofa for 3 weeks. I had a CT scan, went to the emergency room, had an MRI. They couldn't figure out anything. I couldn't drive for weeks. And then that just kind of led into, I really thought I was just having a breakdown because it's a silent journey because you feel so alone after a doctor appointment after a doctor appointment. There's nothing wrong. I had an MRI. I just knew for sure I had a brain tumor because the fog and the extreme fatigue. I got up, couldn't wait to go back to bed. I didn't plan things because I needed a nap. I had zero energy. So literally I thought I was dying. And up until March, I really thought I was dying. And the thing that got me is I started having suicidal thoughts, which was very scary. And again, because doctors couldn't give me any diagnosis, I felt like I was having a breakdown. And I had just accepted the fact I was having a breakdown just with the trauma in my life. I'm losing a sister-in-law to cancer. And so with her having cancer, other women having, and my life having, and I feel like it was just a God wink leading me to get them out, having a double mastectomy. And I just wanted them out. I didn't think that there was any issue. And honestly, I thought maybe it was in my head. My right breast was tingling. I thought maybe because everything was going on. And so the surgeon I went to was referred to by a couple friends in the medical field. I didn't know anything about an explant surgeon. I didn't know that there was someone that specializes in it. I thought you put them in, you take them out. It's as easy as that. Thank God, I got another God wink because one was ruptured, and that led me down the rabbit hole of what does this mean? And then that led me to, I didn't even know a capsule formed around them. That led me to Dr. Khan, and
So you learned about me after you had already explanted?
yes, yes.
Now, let me ask you a few questions. Now, I want to go ahead and mention
Mhm.
this. So when you had the saline implants and you got them changed into silicone, I find from my experience, this is a very common theme. Now, this is all anecdotal. There's no scientific studies that have been done, and certainly they need to be done. The patients say that when they got their second set of implants,
Yes.
that's when the symptoms just go haywire
Yes.
through the roof. And all of a sudden you start that the whole sign symptoms of what is suggestive of what is breast implant illness just take off, and everything is exponentially multiplied, or the symptoms bring on or come on, or that equilibrium. And I've heard this so many times, and this is what I've said is what I call the stir-up phenomenon, where all of a sudden the toxins kind of, you
Yeah.
have a whole sundry list of problems that all of a sudden surface before they were not. So many patients have said, I wish I had never touched my first set,
Right.
because things were really nice at that first set of implants. Now, the second thing I just want to mention here is when you explanted 0 to 10, so the day before, let's say in February of 2025, this is the month before you explanted, how 0 to 10, how bad were your symptoms?
15. I really thought I was dying. I just came to the point where I must be dying and they can't figure out what it is. Maybe it's mold, there's just something in my body they haven't quite figured out, because not that I love my son to death and not that I would want to leave this world, but I just did not want to live another day the way that I was living, because it's not living. It is existing, trying to function. He used to say, Mom, do you remember that? And I would shake my head yes, and he would say, you don't, do you? And I felt like I had early on dementia. Because I couldn't remember anything. And it takes the joy out of life, out of things that I want to do, because I can't remember anything. And I've been single for many years. We lost his dad 20 years ago. I've been very independent. I look back, I built a house on my own. We had a construction company. And it's like, what has happened to me? I literally can't function. I can't think. I would look across from my desk and just sit there. I can't remember what I was even doing. And I always say, well, tomorrow I'm going to do it. I had a to-do list. I would try to get through one thing and then, okay, tomorrow. And I laughed and I called it the art of procrastination. But I'm just so thankful to have found Dr. Khan. His heart is so genuine. He's so transparent. He doesn't hide anything. The other physician I went to kind of mocked me for having these symptoms. It's all in my head. You'll be back in a year to get them put back in. I said, I assure you I won't. I just want them out. I want to be healthy. I want my life back. I thought he was a little arrogant, but then again, I didn't know. I didn't know there was a specialty.
Did you, when you talked to him, did you talk about removal of the capsules or no?
I wasn't aware of the capsules at that time. But then after the rupture and I went for my follow-up, I started asking him questions and he said, you need to stay off the internet. That's getting in your head. And then the more I've watched so many of your links, and I just felt, and that's what I said when I went in last time, he was still mocking me. I said, something is wrong with me. And I said, I know my body and something is not right. And I want to have the capsules out and I'm going to have them taken out just for my peace of mind. And that's what I love about you, is that you are so in tune with what we need for recovery. Is we need to see pictures. We need to know that everything is taken out. I don't trust a thing that other surgeon said. He said my capsules were very thin. They could be left in. They were not very thin. They were very thick. They were calcified. And if you see those pictures, just the thought of leaving all of that toxin in our body. And the sad thing is that we're so uneducated. We don't know these things. We go to doctors trusting that you're taking these out. You see this on a daily basis. I was never told, my sister-in-law was never told, we're supposed to have an MRI every 3 years. No one said that to us. I was told that, and the only reason I got the second implants is because it'd been 20 years. I thought when I had a rupture, I would noticeably see that. And, I had no idea I had a rupture. And so he talked me into getting the gummy bears. You can run over them with a car. You'll never have to have them replaced again. This is my 5th surgery with Dr. Khan. And I love how you're so informative too. When I was a young woman at 26, I did not think that I'm going to have 6 more surgeries, just 6 more surgeries in the best case scenario.
Mhm.
That's not if there's any complications, if there's any infection, if your body's rejecting it. And so I just thank you for being an advocate, for being a voice for us. And I thank you so much for doing my surgery.
No, thank you. No, I will tell you, I appreciate you coming forth and talking because a lot of ladies can relate to you.
Mhm.
And this is where anyone who's interested in thinking about implants, realize that your implant 6 years,
It's not worth
it
it.
was ruptured maybe a year ago, maybe 6 months ago. Now, the other thing is, so now when you explanted in March of 2025, just a couple months ago, how much did you improve?
Oh, I already improved dramatically. I would drink 3 to 4 cups of coffee a day, and my son would give me such grief, and it's like he had no idea. That was just to barely function. And now I have a cup of coffee, like I've had maybe 3/4 of a cup now, and I just feel clarity. I feel energy. It's just an undescribable fatigue that I can't explain to people. You can't possibly, it's not like a tired in my head. It's like my bones, my body, my muscles, everything within me is just exhausted.
Now, so you had your surgery done in March of 2025. The explant was done. The capsules were left behind. It was a ruptured right implant. So let's say a week ago, before you came and saw me, if 15 is where you were in February, like a month before you explant, how much were you last week at this time?
I'd say I was 5 or 6.
So that is a remarkable improvement from 15,
Yeah. Oh,
let's say
yes.
subjectively
Yes.
to 5. Now, I will tell you, it takes a lot of guts to make the trip and say, you know what, how did you know? And this is, remember, I was even questioning you, and you and I talked on the phone, we did the phone consult, and I was like, how sure are you that the capsules were left behind? Now we know
Right.
that the hour-long surgery in itself tells us that there was no definitive plan on removing the capsules because the surgeon did not and could not have done the surgery in an hour with those relatively speaking large implants that you had. Now, you are a 5 out of 10. You're dramatically improved, right? You're functioning. Now, what amazes me is the fact that you said, and in just 2 months, that you know what, I improved, but I know I can do more. I can do better. I can get the residual capsules. Because that in itself is another level of thinking where you're overriding the system, if you will, and saying, you know what, and then 2 months, I'm going to go ahead and get my residual capsules removed. That is a pretty strong force, and this is why I say, you know what, I need to interview you. I need to have you think, because not everyone thinks like that. Because that is exactly what I preach, what I teach, and what I tell everyone, that you have to get the whole capsule out. And in your case, when I went in, the capsule was very thick, almost 1.5 millimeters thick. And as I cut through the capsule, you could hear it, and I had to apply a lot of force with the heavy scissors to cut through. And I just showed you the video. There was free floating silicone within the capsule, and there was fluid inside that was present, which is not uncommon given the seroma, because your plastic surgeon, I don't want to not know the name or who or he or she was, but I just want to mention, told you that you did not need to have compression.
Mm-hmm.
And this was something that you yourself said, I'm going to get a nice, good, tight sports bra because I know I need it.
Mm-hmm.
And this was very nice and intuitive on your end, because just like after a tummy tuck or a thigh lift or arm lift, you have to have compression on. It's very typical and standard to basically put the compression on so that dead space, if you will not accumulate fluid.
Mm-hmm.
So you were able to realize now that 5 out of 10, quote, 0 being normal, 10 being the worst, and you were a 15, and post explant you were a 5. What was going through your mind in order to say, you know what, I'm going to put a lot of time, effort, traveling, finances, all of that to come here to get the residual capsules? Like, what was that motivating force, that driving force for you to come here? Because you've already improved from 15 to 5.
I want to be the best I can for my son and daughter-in-law, my future grandchildren. In the last 6 years, I just feel like I've missed out on life. And I want to live. And it was so expensive to get the first surgery and then to do the second surgery, but there's nothing, we'd get everything for our health. And so, this was minimal to me. I just watching video after video after video of you and your transparency, I just wanted it to be you. And I felt like God aligned me to find you and to come here. And I'm so thankful for the resources. There's a lot of women that aren't able to get them because this isn't covered by insurance. It's sad that we make a bad decision at 26 and we have all these out-of-pocket expenses with no help. But also we're not informed of
let me correct this.
Yeah.
You did not make the bad decision. If I go buy a car and we know it will catch on fire, let's say, and it's going to have problems, and I'm led to believe that that is a good product, I will go buy it.
Right.
Now the burden is on someone who's selling me that bad stuff. And this is the problem here, where the many ladies, well over 99%, even today's age, if I go to the last 100,000 ladies who have gotten implants, and I say to them, do you know that there are not lifetime devices, that there is a very small, rare association with lymphoma, that there's a potential for rupture? At Mentor, for example, you'll have to get a MRI at year 3, and then every 2 years there onward, you have to look out for any fluid buildup, potential rupture. You have to get malpositioning, acute and chronic pain, chances of infection, capsular contracture. All of them will say, no one told me that. If anything, they're told the opposite. They're very safe. This is the standard of care. You deserve the best. You're going to be depressed if you don't get these. And you're not only getting the best, just like you said, you can drive a F-150 truck over them. And unfortunately, this gummy bear, the one who came up with the gummy bear, term, it was very smart, because everyone can relate to it. And even if you cut through it, yes, that's true. But as you will see, there was free floating silicone in your right chest, and the capsule was as thick can get. And I said to myself in the surgery that this was not at all what was a thin capsule. This was not at all a silicone that should be left behind. It is not healthy, and there was a lot of inflammation. So I'll be curious to see what the pathologist says. Now, I will tell you, you're still 96 hours or so out from your surgery.
Right.
This is still very early on.
Yeah.
For me, this Facebook Live is more like, let's go ahead and capture this time.
Yes.
4 days out, where you are right now, because we'll do another one 6 months out. And I will tell you, we want to hear back from you. We want to see where and how you're going to improve. Now, you told me something that I want to mention right now, that you're already showing signs of improvement, right?
Oh, yes.
Subjectively. And we're going to all take that very, very anecdotally, because this might just be a coincidence, right? So we want to hear from you 6 months out or so, plus minus, just like the one I did with the nice German lady.
Yes.
And so we hear directly from you, so that we can say, is it my word against the plastic surgeon's word against your word? And you know what? At the end of the day, your word beats everyone. It trumps me. It trumps every single plastic surgeon. It trumps the system, the textbooks, the journals, all the safety profiles, whatever that have been documented, because your words override everyone else. And this is where we want to hear, and I let the plastic surgeons and the significant others and the many other ladies who are listening, you have to listen to the patients, and the patients are coming forth because what you said to me, remember I even questioned you in pre-op, that when I first saw you, do we really have to go forth? How sure are you the right one was ruptured? Your plastic surgeon even mentioned that your implant was below the muscle.
Yes.
That is very interesting because I said the story is not adding up, and I said, do I really need to believe everything you have to say? We have to justify going into the operating room because it's too sacred, it's too big deal,
Right.
it's too much of a big deal to go into surgery. And lo and behold, looking back at it, absolutely you needed the surgery, absolutely you needed the capsules removed, and absolutely you needed all of that fluid that was in there contained and removed. And I will tell you, having done literally thousands of these, you're only going to be healthier. There's no surprises awaiting you. You have the peace of mind,
Yes.
as you will see all those pictures and videos that we took, so that you know all of it was removed in the manner that we have discussed and described, and that you have the peace of mind that all of it was tested, and that you have the peace of mind in the future you have no surprises awaiting you.
Yes. I know that I've done all I can do now to make sure that everything is out. Whatever pathology report comes back, then we'll handle that. But I'm just glad that I have everything out. And I will say, in this short amount of time, again, I thought this was related to menopause. I had so much stress growing up, but I would just rise to the occasion. But in this last 6 years, it literally just shut me down where I couldn't think straight. And already I can tell the difference of when I feel anxious, it's not like this. I can't think straight. It's a little anxious in my chest, but I move forward. Whereas before, I completely shut down. Now I look back on suicidal thoughts and I'm like, wow, I just can't even believe that my mind was in a space. And the greatest thing is that, yes, I know my body and I'm not losing my mind. So I do want to be a voice for women, to continue to pursue, educate yourself, listen to your body. I tried to stop a few friends from getting implants after double mastectomies. Like I said, it's your choice. All I do is have the heart. I want to inform you. One already had an infection rejection, taking that out, an expander after already doing the double mastectomy. Now she's waiting for the infection to go down to remove the other one. She assured me her doctor was wonderful, had her best interest. I said, I assure you, any doctor that is encouraging you to put in implants does not have your best interest. So please just listen to your body. And that's all I can do is just tell you what I've experienced. And then it is up to you to listen to your own body and continue to educate ourselves and other women.
No, very well said. And I will tell you, each and every single word came from your heart. And I want to mention, ultimately, the patient is the boss. We have to listen to the patient, and that is the root cause of the problem. The patients are being dismissed.
Yes.
I will tell you the many and unfortunately situations where the patient is being dismissed and saying it's stressed out or this is all in your head, that you need to be on anxiety medications. I've been told the same thing, that basically I'm propagating what is not true. Absolutely not. I would love to put in an implant every single hour of my life, but I will tell you what you said earlier, it's not worth it. If you look at all the good and all the bad, there is a mountain of badness. And my take-home message to everyone, you're the boss. Just, you said something that first time when I met you, and today you saw a lot of videos, the transparency, and you will see that on the videos that you're going to see of your chest, how and what was found and what was removed. You want to have that peace of mind so that you did everything according to the book, and that you have the peace of mind, no surprises are going to await you in the future, and that everything was tested. And do your homework, do your research. Don't rush into an explant. You need to know what it means getting implants, what it means maintaining them, and what it means, what is a surveillance, and what to do if you're in that situation where you are hurting. That one of the differential diagnoses is truly silicone toxicity, the breast implant, unless that there is relief out there. We will love to hear from you, and November or so, that's going to be the 6-month mark. So we hear directly from you as your pathology comes forth. We will discuss that as well. And no, thank you very much for sharing your journey. And I'll let you end with any final word
Yes,
that you have.
and I also loved how you said, you don't want to go to a surgeon who puts them in because they're not going to have the same heart. If their heart is truly in it and believes in breast implant illness, they're not going to be putting the devices inside of us. So that's the first red flag I should have had when I went to the surgeon, because if you're getting mocked, if you're not getting listened to, then you need to find another surgeon. And I'm so glad, because absolutely everything I did was, you're depressed, you need to be put on an antidepressant, you're depressed, you're depressed, you're depressed. Thankfully, I didn't do that, so I don't have to detox from being on an antidepressant. I was like, I want to live. I have so many things I want to do. I'm depressed because I have no energy to do it. So listen to your body. Just continue to fight to live, and come see Dr. Khan.
No, thank you. I just want to take this last word that you said and say, how did I know that your surgeon did not do the right job? And this is number one, the hour-long surgery. On average, I take 4 hours plus minus. Number two, this length of the incision was so small, you cannot do a total capsulectomy or an end block when you have a small incision. That was the same case I did this morning. The lady had 1 hour long surgery, and number two, a very small incision. Number three, the implants were not returned to the patient. That is another big red flag. Number four, there is no high definition pictures and videos of the chest wall showing complete removal. The capsule is not, number five, sent to pathology, because that becomes the proof. How much did you remove? Because some surgeons, like the one that I did from the nice lady that came from Arizona, her surgeon removed the capsule and sent it off to pathology. And you can tell from the pathologist's measurements that this is an incomplete capsule, because it's half the size of what it needed to be. And that is the proof that you did not remove it. So many surgeons are not excited about sending it, because that's the proof that what was removed was not adequate. And number six, your surgeon is not augmenting, because that tip that classically authenticates and certifies, if you do a surgery, in the time that I spent to remove your capsule, I could have put in 4 implants, easily 3. And I would have upped my salary 3 times, plus a lot less painful, a lot less meticulous, and relatively straightforward. So a surgeon who is not augmenting and only explanting is that right surgeon who firmly believes that I'm not going to do any harm, and that it's not worth the harm. So this morning I talked to and actually texted a surgeon who used to augment a lot and now give up and now only explants. And he's an advocate, talks about it, is part of a group. And I have all my faith and effort in that surgeon, because he is not augmenting, he's only explanting. And so that speaks volumes. And the surgeon must be actively talking about it. That I find is very important. Now you still will find, I know a couple surgeons who are unfortunately in this, and they will kind of do all of this, and they still are not firm believers, because in their group there are other surgeons who are still augmenting, and they divert the traffic to those surgeons who are augmenting, and another surgeon who's sold simply so that he is the explant surgeon and that he has more credibility. So you still have to be careful, and you have to trust your surgeon from your gut. That I would call is number 7, because that way you know from your heart that your surgeon did the right surgery. So,
And I want to say also, just 2 other things, is when I went back for the follow-up with the other surgeon and asked why wasn't anything sent to pathology, I came in with all these symptoms, wasn't he curious? He said he wanted to save me money. And the other thing that was repulsive is that he said, I said, well, why didn't you remove the capsules? For one, it was too thin. And he was more concerned about what it looked like on the outside than actually my health. And when I went to look at the post-op notes to see what really happened, because at first he told me never seen a rupture so bad that didn't leak. Well, then when I read the post-op notes, it said minimal leakage or something. So I went back to question him on that. And I noticed he put on there, I came to him for cosmetic reasons. And I said, I want that changed to BII symptoms, and he refuses to change it. I don't know why, but I didn't go for cosmetic reasons. I went there specifically for BII. And so all of those little things you just need to, when it goes off. But again, I was uneducated, and I'm so thankful for the rupture. It led me to educate myself, to hopefully be an advocate for other women, and we'll get educated.
Sure. No, I want to mention something. There's another point we can talk forever.
Yeah.
What surgery you got in March of 2025 was the most non-cosmetic surgery that anyone can get, because you got an explant, you didn't get any fat
Right.
transfer, which we're going to talk about very soon from last week's Facebook Live. Was the most non-cosmetic surgery that you ever can get, which is an explant of a large implant. And so he should mention and must mention, this is another Facebook Live. I did it with another patient a couple of years ago, where the surgeon who is explanting refused to write down breast implant analyst desire for removal of bilateral breast implants, non-cosmetic surgery, essential surgery, medical necessity surgery. He did not want to utter the word breast implant analyst or write it down, because now he will scare off the many other patients. They don't want to talk about it. And unfortunately, how can you even do a surgery if you're not going to even document it? And that in itself is a big red flag. No, thank you very much for sharing your journey. It was an absolute pleasure, and thanks for sharing your experience. We will have the pictures and videos in the future. We will discuss your case, because I will tell you, every case is important, and the many Facebook Lives that I do, yours is the one that I always say is the worst case scenario, where you've already explanted and now we have to go back in, just like this morning at the hospital. The patient was 9 out of 10 bad, not able to get out of bed. Patient was a nurse this morning, full functioning human body, young lady in her 40s, and the detrimental effect of the breast implants from what is residual capsule, residual burden, residual toxicity. And we will certainly hear from her as well. And we're trying to make this a better experience for the ladies, so that when you look back at it, you can see, you know, you got the best experience, the best surgeon who was committed into removing the capsule sincerely, completely, faithfully, definitively, and that he truly cared and listened. And that is basically what this surgery is all about. You may get your gallbladder out, who cares? But when you get, because it's out, it's out. It's only done in one way. You cannot leave it behind. But when it comes to an explant surgery, every surgeon has their own way, style of doing it. There is no textbook definition. All the surgeons who have done an explant do it kind of their own way, on the job training, so that they define in their mind, I feel like I did it the best way I could. This is not what's about. I want to be transparent and say, you know what, this is how I do it. Every surgeon should be actively discussing how and why they do it in the manner, what's their thought process, why they do not use drains. You know, and this is where, listening to the many videos, you will get a good understanding as to what my practice is about, because I want to be very transparent. And there are many patients that I've talked to that I tell them, and all the patients that I talk to, that I tell them, you're the boss, you decide what you want to do.
Yes.
No, thank you very much.
Thank you.
Thank you.
Oh, we could sit here and chat all day, couldn't
Yes,
we?
yes, yes. You know, I will tell
Thank you
you,
so much.
you know, you're welcome. And you know, I will tell you, your words are going to change many people's lives.